When we think of diagnosis and treatment, how do we diagnose PCOS? And you touched on some of the signs before, but can you go over that again and maybe include some of maybe the lab work that may be included when we're talking about diagnosis of PCOS?
So first we take their history. We talk to them about their periods. We talk to them about symptoms like skin conditions, weight, etc. And then we may get blood work done to check their hormone levels like testosterone levels, their estrogen levels. We want to rule out things like the thyroid issues that could also be causing period problems and fertility problems. So those are commonly the blood work labs that we're checking. We'll also probably check things like your cholesterol, your blood sugar tests, because we want to look at those other conditions that come along with PCOS. And then we may get ultrasounds to check for those polycystic ovaries. And also, if someone's having those bleeding issues, we want to check for other things that can cause bleeding problems.
Now, when we talk about misdiagnosis, is PCOS ever misdiagnosed, or could it be mistaken for a different condition?
So anything that can cause the testosterone to be high can cause very, very similar symptoms. So for instance, if someone has an adrenal gland problem, there's certain hormone problems with that can mimic PCOS. Or like we mentioned thyroid a couple of times, that can throw off your weight and your skin and your periods and all of that. So there's a lot of overlap with some of these other hormone conditions.
I think the hormone, we talked about it, the community, the neighborhood, a lot of overlap. And so it's important from a medical professional perspective to make sure we're not missing something. And so that's why a lot of times it can seem overwhelming for a patient who comes in with potential PCOS as a diagnosis, is that we have to actually look at a lot of other things to make sure that nothing is being missed. So have patience with the doctor.
So we've talked about it a few times in terms of just wellness, lowering the blood sugar and lowering the insulin levels. Sometimes will actually automatically reverse some of the hormone imbalances. So again, we used to kind of talk more in terms of pounds, like lose a certain number of pounds. Now it's not so much that as, watching things like your blood sugar and exercising and, taking over kind of just overall wellness. Sometimes that will actually reverse the hormone imbalances. And sometimes, you're factoring in some of the medications like metformin or GLP-1 can actually more directly change the hormone imbalances. So it is something that we talk about, all of these lifestyle changes as quote unquote natural ways that sometimes you can treat PCOS.
I'm glad that you put it in lifestyle as that category, because really the body and the treatment of so many conditions requires like this symphony of different things. It's never going to be just one thing. Someone may respond to a medication differently than another person, but ultimately, when we have that underlying foundation of nutrition and exercise and mindfulness, that actually is going to carry so much weight of how their body responds. And I think that that's where we are, again, going in medicine, which I'm very glad that we're doing that, because it actually takes the pressure off of the doctor and the patient to adhere to like this one thing that has to be done or this one organ system that has to be perfect. It really is kind of across the entire body, but also across lifestyle as well.
And something that I wanted to bring up, we brought up like the idea of shame or blaming a few times. I do want to point out, for people who may have heard like, well, if you do this right, you're going to reverse all of your PCOS and you will never need a medication. That is so harmful because people then blame themselves. Like, I didn't exercise hard enough. I didn't fast or do the special kind of secret sauce. And I think that is, something that really is kind of putting boundaries to actually getting treatment, because people think that, well, I failed, like I didn't do it hard enough. So this is where we say, medications sometimes come in like that we do need to give sometimes, birth control or other medicines that actually will help out, because you kind of take it as far as you can within your control. And then that's why medications exist, is that you may need them. It's just like, for cholesterol, like some people will need to take medication for cholesterol. So just like someone might need medication for their cholesterol or their type 2 diabetes, they've maximized their, nutritional status and their exercise, but they may need medication to help take them that extra step.
Stay tuned for more discussions with leaders in women's health. Remember to subscribe to our channel and follow us wherever you get your podcast. And with that, I want you to stay well, and I'll see you soon.